I am a mother to 2 adult children, and Daniel is my youngest child. I'm an allied health professional. I work part-time. Daniel is 25. Daniel's passions in life are music, and he loves to listen to all types of music, sing. He has cerebral palsy, spastic quadriplegic cerebral palsy, and he's got an intellectual disability. He has had multiple hospital admissions. He's got hydrocephalus, and so has had a number of admissions for that, but also admissions and surgeries for a number of other conditions. Right from the very first interaction with the first nurse that we saw, and she appeared to be reading off a checklist, but she asked us some really appropriate questions and spent a bit of time just going through Daniel's needs, asking, how the best way to communicate with him, what physical support he would need in terms of equipment, how he transferred and things like that. Is simple things like if we can even get a bed to stay. People with disabilities often need closer monitoring, I think. So there's been repeated mistakes made with Daniel, and I think often things are picked up, maybe in able-bodied people, because if a mistake is made, the person will verbally report that they're feeling a bit unwell or whatever, and often people with disabilities can't report that. If staff could listen to us as the carers so that we can tell them our concerns about Daniel's current health situation and how that differs to his normal situation, about how he communicates, about other care needs, even things also like what position he needs to be in to eat because he's got dysphagia. All of those things are really important to his health and well-being and safety, and often makes the staff's life easier. I've taken a video of Daniel when he's well and happy, which I have on my phone, so if he's admitted to emergency, so that staff can make that distinction between what symptoms are due to the presenting illness and what is his general condition. Advocate strongly for your loved one. Don't rely on the system to take care of them, and be familiar with their loved one's medical conditions and medications and that sort of thing. The other thing is that if you think that there's been a medical deterioration that hasn't been acknowledged, you can also speak to medical staff about the REACH program to escalate a clinical issue, and we've certainly done that on a couple of occasions, and that's actually been quite successful and appropriate for Daniel. I do feel that the public hospital system has generally catered much better for Daniel than the private hospital has, particularly in regards to staffing ratios and just being more focused, I think, a bit more patient-centred and having appropriate equipment, and I think a bit more desire to provide a better level of care, which surprised us.
What do you think of in the absence like I'm in live? I'm all shook up.
Wow, that's
wow!
Great singing!
Great singing! Great singing! Yeah!